Hi everybody, welcome to Healthline. I am Gregory Zarian. Thank you for joining us. So it's fall. We just had Halloween. As you all know, October is Breast Cancer Awareness Month for women. Ladies, did you go get your mammograms? Men, did you do your self-exams? You know, just because it's marked out in 1 month doesn't mean that you don't always talk about wearing pink and self-exam and doing your own work in regards to you and your health. It was also Thanksgiving. I hope you had a great Thanksgiving. We at Healthline are very thankful for you and all that you give us, and we hope that you are really enjoying all that we're giving back. It's also November. Gentlemen, it's Movember. It's about you and your health. It's about you growing a mustache or growing a beard and getting the conversation about you and your health on. Did you get your prostate checked? Did you go get a colon exam? Or are you just going to the doctors to take care of yourselves? Because men, you know that we don't take care of ourselves as much as women. Our mission at Healthline is to give you as much information so you know all that you need to know about you and your health. Now, with it being the fall, it's all about the flu. The conversation today is all about whether or not you get the flu shot, what is the flu shot, and why you need to have it. Joining us is Dr. Arlet Sarkissian from Glendale Adventist Medical Center, Family Practice. How are you, doctor?
Good, thank you. How are you?
I'm good. Thank you for being here. Before we dive into anything, doctor, tell us where you went to school and some of your history.
Sure. I went to UCLA, where I obtained a degree in biology.
Okay.
And then I went to Touro University in Henderson, Nevada for medical school. And then following that, I did a 3-year family medicine residency at College Medical Center located in Long Beach, California.
So out of all the areas in regards to medicine, you decided family practice.
Yes.
Why family practice?
I always enjoyed family practice. Even before I went to medical school, I knew I wanted to be a family practitioner because it covers a wide range of areas from adult medicine to pediatrics to OB/GYN. So I enjoyed the fact that I get a full exposure to all sorts of people, all sorts of pathologies.
And you also get to get involved. A lot of family practice is becoming very involved in the family.
Absolutely.
Well, from me, from my family to you, thank you for taking care of families. Okay, so it's flu season. Do you or don't you need a flu shot? More with Dr. Sarkissian and what the flu is all about when we come back. Don't go away. Welcome back to Healthline. I am Gregory Zarian, and the conversation today is all about the flu shot. It's the fall. People get sick. Do you or don't you need it? But before we dive into that conversation, let me share with you something wonderful about Glendale Adventist Medical Center. Glendale Adventist Medical Center is ranked 4 out of 5 stars by the Centers of Medicare and Medicaid Services for its star rating. That's in the top 20% of hospitals here in California. So when you're wondering where to go, there's no need to look further. Go to Glendale Adventist Medical Center. Joining us is family practice Dr. Arlet Sarkissian, and your mission is taking care of families.
Yes.
Which I love that you said that. First of all, what is the flu, doctor? And why does it only happen? Because when we think of flu season, we think of maybe when summer ends and then we start hearing everyone talking about, okay, fall's coming, go get your shots.
Yes.
Is it yearly or just why does it hit during the fall?
Yes. So influenza is a contagious respiratory illness that is caused by influenza virus type A and B.
Okay.
And it typically infects the nose, the throat, and the lungs. And it is
And when you say nose, throat, and lungs, that's your respiratory system.
Exactly.
Okay, so for those of you that want to know what your respiratory system is, it's nose, throat, and lungs. Perfect.
Yes. It is contagious. Most commonly, it spreads by droplets. So by coughing, sneezing, or even talking, one can acquire the flu. It could also spread by contact.
Okay, so through saliva, through touching, being intimate, and any of that.
Yes.
But here's my question though: why is there such a conversation of the flu in the fall?
Mm-hmm. So typically, flu season starts from October and it runs through May.
So then, from May back to October, people can still get the flu?
It is possible, but it's mostly prevalent from October through May. That's known as the
flu season.
Why
is that? Is there a reason? Is there something in the air? Is it because there's more allergens? Is it because that our body's more susceptible? Is there a reason, or is it just that our bodies kind of break down a little bit more at that time for influenza A and B, as you said.
Well, it's kind of hard to say why it happens specifically during that period of time, but during the winter season, people are confined to more closer spaces, so that increases the chance of people passing on infectious diseases amongst each other.
Well, because it's cold and you can't be outside.
Yes.
But then let me ask you a question. Could it also be because of the weather, and not so much here in California because we don't get super cold, but could it also be because of the weather, there's not as much activity? You know, when you work out more and you get more active, your body, I feel, takes better care of itself. Could it be because we become a little more stagnant and not as much cardiovascular, not as much, health and wellness as we do outside?
Certainly, physical activity does improve the immune system in general.
Okay, so let me just throw this out there. During the season of October to May, and if you have to stay inside, you can still be active inside. You can still, go to the gym. There's inside gyms. There's also these spinning houses, boot camp houses, but you can also stay inside if you are snowed in. There's tons of exercise you can do and get your cardio inside.
Absolutely.
So you don't have to give us the excuse of, oh, I got snowed in, that's why I gained weight. Not going to happen here at Healthline. Okay, so you said there's two types of flu.
Yes.
Influenza A, influenza B.
Yes.
Why are there two? Why isn't there just one?
Well, there's many different types of flu viruses out there. However, because they have a high rate of mutation, there's different variants.
Okay.
And that's really the reason why there's a new influenza vaccine every year. It's because of it's due to its high rate of mutation.
But let me ask you a question though. Since I got my flu vaccine last year,
Yes.
it doesn't do anything for me this year.
Not necessarily, no.
Could it be the same virus though?
Generally speaking, influenza viruses have a high rate of mutation.
Which means they change.
They change, exactly. So the flu vaccination that you got last year may not necessarily protect you this year.
How long does the flu vaccine last? 1 full year? 1 calendar year? Meaning
So
if I got it October 25th last year, October 25th this year, am I covered? And now my body's like, okay, it's now time?
No. So the CDC, the Center for Disease Control, recommends an annual influenza vaccination for all individuals starting from the age of 6 months and higher.
Okay.
So last year's influenza vaccination may not necessarily cover you for this year. So you need a new vaccine.
Which I just got, and I'm a big flu shot fan. You said that there are two types, influenza A, influenza B. What's the distinction between A and B?
The distinction is more so biochemical, the type of antigens that they have,
Okay.
the proteins in
Okay.
the virus.
So it's not really. So if you say I have the flu, are you going to tell me that I have flu A or flu B, or just going to say you have the flu?
You have the flu.
Is influenza bacterial or viral?
It's viral.
And what is the difference between bacterial infection and viral infection?
Well, there are two different types of organisms.
Okay,
They're both
organisms.
microscopic.
Okay.
However, virus is completely one separate organism and bacteria is a different organism.
Because antibiotics can take out.
Antibiotics treat bacteria,
Okay,
but it does
bacteria.
not treat viruses.
Okay.
Yeah, and there are antiviral medications available for flu, but antibiotics will not be effective. for
And
the
once again,
influenza.
the flu is a.
It's a contagious respiratory illness.
So it's not a virus or a bacterial.
It's a virus.
It is a virus.
Yes.
It is a virus. Why do you personally recommend getting a flu shot?
I recommend getting the flu shot for several reasons. First of all, it protects against the development of the flu,
Okay.
or it could reduce the severity of the flu.
Okay.
It could reduce time off taken from work, time off taken from school, but most importantly, it reduces the chances of developing complications, and some of the complications may potentially warrant hospitalization because it can cause death.
Well, I was doing a little research that it says around 36,000 people possibly die every year from the flu.
Yes.
And that's just because their body's broken down, because the flu is that extreme. Why do you think the numbers are that high?
Well, there's a variety of factors. It's multifactorial, but there are certain populations that are at higher risk for developing a severe complication of the flu. So
Wait, hold that thought. I love a good cliffhanger, not plot twist. Well, it could be a plot twist, but it's a cliffhanger. Okay, so if you want to know what populations are more susceptible to the flu, do not go away. Actually, you know what? Go get a glass of water, get some tea if you're cold, turn around, come back, and find out the answer to that. Welcome back to Healthline. I'm Gregory Zarin, and the entire conversation is about the flu. And joining us is Dr. Arlet Sarkissian, and she shared with us a great cliffhanger as to what population is more susceptible to the flu. Thank you, Dr. Sarkissian. So what population is more susceptible to the flu?
So first of all, adults over the age of 65.
Okay.
Adults over the age of 65 comprise 80 to 90% of flu-related hospitalizations. So by and large, they take the greatest brunt of the disease.
Why? Is it because they're older? Is it because they don't take care of themselves? Their respiratory system is a little more depleted?
So first of all, as one ages, the immune system, the effectiveness of the immune system can decrease. And in addition, as one ages, that increases the risk of having more underlying comorbidities. So they may have underlying medical conditions.
Such as?
So for example, if an individual has a
And this is over the age of 65?
Yes.
Okay, specifically we're talking about somebody over the age of 65.
Well, in general, diseases can occur, at any age, but individuals over the age of 65 can have congestive heart failure. Okay. They can have a history of a heart attack, chronic obstructive pulmonary disease. Diabetes, certainly, yes. And individuals who have these underlying comorbidities need to be particularly careful, because if they have influenza, it could increase the risk of COPD flare-up or a congestive heart failure exacerbation.
Can you share real quickly what COPD is for those that don't know?
Sure. So it stands for chronic obstructive pulmonary disease, and it's a result of being a chronic smoker, basically. It causes obstruction of the lungs and shortness of breath.
And being a former smoker. Quit smoking. How did I do it? I just said I'm done. There. No more excuses. Okay, continue. Well, I'm adamant because I lost my mom to smoking, so okay. I don't. And my older brother survived bladder cancer, and for all of you gentlemen, bladder cancer is contributed by cigarette smoke. Quit smoking. Thank you.
Yeah. So the second population that is going to be at risk for flu-related hospitalizations are going to be the young children. Children under the age of 5, but specifically under the age of 2. And studies have shown that receiving the influenza vaccination decreases the risk of children being hospitalized in the PICU, so the pediatric ICU.
How old? So you believe, what is the earliest?
6 months.
So you believe, would a 6-month infant wouldn't get the same influenza shot that I got? Would the child get the same shot that I get?
So there's different formulations of vaccinations available.
Dependent on age?
Yes, it depends on your age.
Okay.
And I recommend all patients to speak with their physician as far as which formulation is right for them.
Okay.
But the current recommendations state that for children from the ages of 6 months to 8 years of age, if they have never received an influenza vaccination, for this season to receive 2 influenza vaccinations.
But the same vaccination though?
Yes.
Get 2 of the same, okay.
Yes, so the first vaccination primes the immune system. The second vaccination protects the immune system.
Wow.
And these 2 vaccinations need to be given 28 days apart from each other.
Okay, so I love that. Going back real quickly to somebody that is of 65 years and older.
Yes.
Bottom line is just take care of yourself. Because a lot of this, you wake up one day, my grandma said something wonderful one day. She said on her 83rd birthday, I woke up and I was 83. So we get there really quickly. Yeah. So a lot of people think I can do it tomorrow, which is not necessarily true, because you wake up and it's already tomorrow. So taking care of yourself today just makes you stronger for the future.
Yes.
Which is common sense.
Yes.
But there's a lot of people that don't adhere to that. Is there something specific? So if somebody at the age of 65 and older gets the flu, is there time out, per se, from getting the flu going to be longer than somebody that is younger?
So individuals over the age of 65 may have a weaker immune system.
Okay.
So absolutely, it may hit them harder as opposed to someone who is younger and has a more robust immune system.
But the taking care of yourself and getting better is pretty much the same.
Absolutely.
So here's the thing, if you're 65 and older, just get your health on. But it's interesting, there's a lot of people, I believe the people that are 65 are taking care of themselves as if they're in their 50s. So there's, I feel, a new resurgence of just because I'm 65 and older doesn't mean I still can't act like I'm in my 40s and 50s and stay very strong and healthy.
Absolutely.
Why do you believe everyone should get the flu shot? Because there's this huge conversation about some people that are so adamant about not getting it.
So everyone should receive the flu shot for various reasons. Again, so it's going to protect individuals over the age of 65. It's going to protect the kids. It's going to definitely protect pregnant women and their babies.
So no matter what stage you're on your pregnancy, you totally...
Absolutely.
Okay.
Absolutely. The pregnant women can receive the flu vaccination.
Does the vaccination go... Well, of course the vaccination goes to the child they're carrying. Does that strengthen their immune system as well?
So if a pregnant woman receives an influenza vaccination, it's going to protect the woman during and after the pregnancy,
Okay.
and it's also going to protect the baby during the pregnancy and after the pregnancy. And there have been, there are cases of influenza infection causing, for example, some congenital abnormalities.
Okay.
It could cause premature birth. Preterm babies, these types of complications may occur. So pregnant women need to get it. People who are immunocompromised also need to get the flu vaccine.
What does that mean?
So for example, individuals who are on chronic steroid therapy, individuals who are undergoing chemotherapy due to cancer, their immune systems are weaker.
Completely depleted.
Well, it may not necessarily be completely depleted, but it is weaker in comparison to someone who is not undergoing that type of treatment. And also another important reason to get the flu vaccination is because, in a way, it indirectly protects other individuals, which is a concept called herd immunity. So if everyone gets vaccinated, then if there's a certain population who is not vaccinated, then in an indirect way, we're also protecting them as well.
Oh, so it's kind of the shot that keeps on giving back. More on the flu and the flu vaccine and why you should get vaccinated when we come back. Don't go away. Welcome back to Healthline. Did you know that Glendale Adventist Medical Center has been recognized as one of the best, I'll say it again, as one of the best hospitals by the United States News and World Report in 8 categories for the year 2016 going into 2017. We're talking about the flu. So if you don't have a family practice doctor, just call the Glendale Adventist Medical Center Physician Referral Line. Call 818-409-8100 and somebody will help you find a doctor. Because Glendale Adventist's mission, simple. It's whole person care and God's love. Joining us is Dr. Arlet Sarkissian. Doctor, we've talked about who's at highest risk of getting the flu. Infants and people over the age of 65. And in between, just get healthy, stay healthy, be active. Just because it gets cold out there doesn't mean you can't work out. And you also said during one of the breaks that there's lots of complications from the flu.
Yes.
What are some of the complications?
So the complications may range from moderate to severe complications. So some examples of moderate complications may be sinus infections or ear infections. However, the severe complications, as I previously stated, it may warrant hospitalization because it may lead to death. So for example, an influenza virus may lead to pneumonia. The pneumonia itself may be due to the virus itself, or there may be a secondary underlying bacterial infection as well. It may lead to encephalitis, which is inflammation of the brain, myocarditis, which is inflammation of the heart muscle. It could lead to multi-system organ failure. It could lead to sepsis. It could lead to myositis, which is inflammation of the muscle. It could even lead to rhabdomyolysis, which is breakdown of muscle tissue. And again, in individuals who have underlying asthma or COPD or heart failure, these can you can have an asthma or COPD or heart failure exacerbation or a flare-up due to an underlying influenza.
So you believe that anybody that has a weaker respiratory system, pretty mandatory,
Absolutely.
get a flu
Unless
shot?
if there's any contraindications, yes, there should be.
What are signs and symptoms of the flu, Doc?
Signs and symptoms of the flu include fevers, chills, runny nose, body aches, headache. Typically, these symptoms occur 1 to 4 days after one is exposed to the
Okay.
virus. However, one may be contagious 1 day prior to the onset of the symptoms. So in
Okay.
other words, one may be contagious prior to the onset. And typically, the influenza may be, it can be a short-lived, self-limiting disease in people who are healthy and otherwise have healthy immune systems. But like I said, in individuals who may have underlying medical problems, it may warrant hospitalization. So one needs to be careful about that.
Doctor, what is the difference then between a cold and the flu?
So both cold and flu are both caused by viruses.
Okay.
However, they are caused by different viruses.
Okay.
The influenza is caused by, like I said, influenza type A and B, whereas a cold may be due to, for example, rhinovirus.
Okay.
So they're two different types of viruses. And another thing that distinguishes between the two illnesses is the severity of the symptoms. So the symptoms may be the same. However, the intensity of a cold is not going to be as severe, and it may not necessarily lead to complications as bad as the influenza. It still can trigger, COPD or asthma, but
Okay.
it's not going to be as severe as influenza. Maybe.
If somebody does in fact get the flu, even after, because it's possible they could get the flu after the flu shot, it's not it's preventative. It's not a guarantee that you're not going to get the flu, right?
Correct.
How do you recommend somebody take care of themselves once they get the flu?
So good hygienic practices. I always recommend it. Washing hands.
A lot. Washing your hands a lot, and then also if you sneeze or cough into your elbow, or if you're going to cough into your hand, wash your hands.
Absolutely.
Yeah.
Definitely good nutrition, good rest, staying physically fit. All of those things are going to help with the immune system. So yeah.
Is it true that you, if I heard I actually do it, that if I feel like I'm getting the flu, I will try to sweat it out of my system. Does that work? Have you ever heard of that? Try to set it out. You haven't heard of that?
No, I haven't.
Okay, well then I'm not a doctor, but I feel if you get the flu, put your socks on and try to sweat it out. Doctor, are there any side effects to the flu shot?
Just like any medical product out there that has side effects, yes, the flu vaccination can also be associated with side effects. Generally speaking, millions of people have received it for over 50 years in a safe manner, but can it lead to side effects? Yes, it can. Some of the side effects include soreness or redness of the arm at the site of the injection. It could lead to headache, fever, body aches, but the soreness and the redness is typically the immune system responding to the vaccine, which is technically a foreign object being injected into the body. However, one of the common misconceptions in regards to side effects is people think that if you receive the flu vaccination, then you're going to get the flu, which is not true, because the flu vaccination, again, there's different formulations, but one of the formulations contains an inactivated virus, so it's a killed virus, and another form of the vaccination doesn't contain any virus at all. So it's not possible to get the flu from the vaccine.
Which that's like an urban myth. A lot of people think that
Yes.
if you get the flu shot, you're going to get the flu. What are your final thoughts in regards to just taking care of yourself and getting the flu vaccination?
My final thought is that I would urge everyone to get a flu vaccination, everyone starting from the age of 6 months and up, unless if you have a contraindication.
And when you say contraindication, that just means something specifically brought to your attention by your doctor that you shouldn't get one.
So a contraindication is basically, it means that a reason why you should not get the flu
Got it.
vaccine, and that would be anyone under the age of 6 months. If you have a fever, those are reasons to not get the flu vaccine.
And bottom line, just take care of yourself.
Absolutely.
Doctor, thank you so much for your time, and thank you for sharing with us all we
Thank
need
you.
to know about the flu. Dr. Sarkissian, once again, thank you for taking care of families and sharing with us all we need to know about getting the flu shot. Okay, so why don't you make it family time? Mom and Dad, take your kids to your doctor and get the flu shot. Do it something as a family and share with your kids why they're doing it. Go with your spouses, your partners. Just make it a family event. Our mission here at Healthline, as I've said before, is you, your health. Because the most important conversation you're going to have is about you, your health, and your wellness. So for more information on all that we do at Glendale Adventist Medical Center, please join us on our YouTube channel. Go to GAMC Healthline. You can also follow us on Facebook at Glendale Adventist, Twitter at GAMC Health, and also LinkedIn. And for more information, just go to adventisthealth.org. Gregory Zarian here. We will see you next time. Have a great one. Thank you.